Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. Welcome, everybody. Today we are talking about something we get so many questions about, both in the clinic, but also on our Instagram and email. So we wanted to touch base on the top 5 early pregnancy symptoms. So these are some of the more common symptoms that people get, don't know if it's normal. So we just thought we'd do a podcast around them and address them. And we certainly have podcasts on a few of these that are much more extensive. So when we do, what we'll do is we'll just let you know what episode number it is so you can go and check it out if you want more information. Sarah and I are both here today. We're really excited. We love doing podcasts together. We don't get to do it as often as we like. Yeah, so we actually have created a week by week podcast. So you get all the episodes at once. So if you love binge listening to podcasts, that's perfect. But if you just want to go week by week, these are the things that come up when we're caring for pregnant people all of the time. So we thought we'd just put together a podcast series. You can check it out on our website and we will link it in the show notes below. This is a paid offering and we have lots of special episodes that we don't have in our normal podcast. So go check it out because it's really a great way of getting some good information around pregnancy.
So with that, let's dive into the top 5 symptoms. Number 1, and this is one that we get so many questions about, and that one is nausea. So this is a common symptom for sure, but also it's really important to know that not everyone gets it. It can be anywhere from mild sort of nausea all the way through to actually like debilitating. So some people have just nausea, some people have vomiting that goes along with it, and others don't. And interestingly enough, colloquially, that's a mouthful, isn't it? It's commonly referred to as morning sickness, but it can occur at any time of the day. And unfortunately for some, it can occur all day long. Believe it or not, we still don't 100% know what causes it. So the research suggests that nausea and vomiting during pregnancy might be due to the effect of a hormone that's produced by the placenta called human chorionic gonadotropin, or commonly referred to as HCG. So pregnant people begin producing HCG shortly after the fertilized egg attaches to the uterine lining. And we know that women and pregnant people with severe morning sickness, which is also referred to as hyperemesis gravidarum, have higher levels of HCG than other pregnant people do. We also know that women and people who are pregnant with twins or multiples have higher HCG levels and are also more likely to experience morning sickness. Similarly, estrogen, another hormone that is increased during pregnancy, is associated with an increase in the severity of nausea and vomiting during pregnancy. Now, if you need a silver lining, it's good to know that people with nausea are at a lower risk of miscarriage than those who don't have any nausea. However, if you're not suffering from nausea, don't panic. It does not mean you'll have a miscarriage. It's just a nice silver lining for those of us who experience nausea in our pregnancies. It's important to know that there are a few other things that can actually make your nausea worse, and it's important to know this and treat them. And that includes heartburn, which is really common in pregnancy because of the increase in another hormone, progesterone. Progesterone relaxes and loosens all your sphincters, so those tight little connections in your GI tract, including the one between your esophagus and your stomach, which typically keeps the stomach acid at bay. So treating the heartburn can often help treat the nausea. Another thing to know is that iron, like the ones in your prenatal vitamins, can also worsen your side effects. So we suggest either taking a microencapsulated formation, like a KidStar Nutrients Biofeed. Is that how we say it, Alicia? Yeah, I think so. We always get it wrong. Sorry, KidStar Nutrients. We love your products. We just cannot remember how to pronounce it. Or what you can also do, and this is one of Alicia's top recommendations, is to actually ditch your prenatal vitamins, those big kind of horse pills, and simply take a folic acid on its own and then a kid's chewable. And it's really important that it's the kid's chewable and not an adult because of the vitamin A levels. Now, if those few recommendations don't do the trick, a few other things that you can do to improve your nausea is making sure you have something in your stomach all the time. So, making sure you're not never getting too hungry. So, having snacks on hand. And oftentimes, and I know in my experience, pregnant people crave carbs. But if you can take that next added step of adding in some protein, like some peanut butter on a cracker, avocado on a toast, cheese and crackers, that type of thing, it can help keep your blood sugars balanced because you guessed it, something else that makes your nausea worse is low blood sugars. And interestingly enough, we learned this from one of our dietitian friends. Sour also can really help. And so, doing little things like adding citrus to your water, sucking on a sour candy, or snacking on green apples or green grapes can be beneficial as well. Now, if these tips and strategies that we recommended aren't enough to help you, there are lots of medications that we can prescribe, which are absolutely safe in pregnancy. So, if you're experiencing nausea and vomiting and it's not getting any better despite some sort of conservative at home treatments, touch base with your care provider. We also have a podcast that goes way more in detail about this, and it is our first ever podcast, episode number 1.
Crazy how long ago that seems, hey?
I know. I remember recording it too.
Just so everybody feels better, I had 2 pregnancies, and neither of them did I feel one lickety split of nausea, and they were both fine and normal and happy and everything. So, again, just to reiterate, if you're not feeling nauseous, it doesn't mean that your pregnancy is not viable or you're gonna have a miscarriage. But if you are feeling nauseous, one of the things that sometimes makes people feel better is that the fact that means their pregnancy is probably progressing well. So the next question, also super common, also
Mhm.
involving the gastrointestinal system and also involving our lovely friend progesterone is constipation and bloating. So we've already talked about that hormone that we know and love, progesterone. It helps to get our pregnancy off to a good start. It's really important in our pregnancies, but it also causes slowing down of the bowels. So progesterone is released from something called a corpus luteum, which is a cyst on your ovary, which occurs at the beginning of pregnancy. So, what progesterone does is it helps the uterine linings to stabilize and grow and allows the placenta to attach and grow. Once the placenta is attached and growing, it takes over the role of creating progesterone. In addition, however, to supporting your pregnancy, it can cause some annoying symptoms. So, one of them is the heartburn, which can contribute to the nausea and vomiting. And the other one is constipation and bloating. What it does, it also slows down the smooth muscles of your bowels. So, the smooth muscles, they move your bowels and your gas, move your feces and your gas along your bowels all the way to the end, and then you get rid of it. But when those muscles slow down, it leads to an increased buildup of gas. So that's that bloating. And it can lead to constipation as well. You may be thinking to yourself, we want high levels of progesterone, so I guess we have to suffer, right? Nope, we don't have to suffer. There are some things that we can do to help move your bowels along. So, hydration. The nausea can sometimes impact how much fluid we're taking in. So, do your best to stay hydrated. And that trick around putting citrus in your water is great. Also, movement gets your bowels moving. So, getting out for a walk, doing some mild yoga, anything that helps to get your bowels moving. You may not have a ton of energy, so do what you can, but every little bit helps. And then, if you do need something more than this, you can try a powder called PEG, also known as Laxaday or Restoralax. And this is really safe in pregnancy. We use it in little babies sometimes, and it also helps to get your bowels moving. Caffeine can also help get your bowels moving, and up to 200 milligrams of caffeine a day we think is safe in pregnancy. So again, we did a podcast on this because this is super common. And so that's episode number 10 if you want to go check it out.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
Oh my gosh, we get so many questions about constipation and hemorrhoids. Newsflash, constipation can exacerbate hemorrhoids. So get on top of it early. Follow Alicia's tips. Another common symptom, and one that we don't often talk about or hear about as much, is acne. It's really important to talk about because it can cause concerns with self esteem and it can cause really significant distress for some people. And thank you, progesterone, because it can also cause an increase in acne. So, what's really important to understand is management of acne is different in pregnant people than in non pregnant people because some of our treatments are not considered safe in pregnancy, or we're not sure that they're safe because they hadn't been studied, so we avoid them. But what's really important to know is that there are lots of safe ways to treat acne in pregnancy. And if you're experiencing worsening of your acne, please seek help. So, a few treatments that we do recommend in pregnancy include one is azelaic acid. And so it's thought to be safe in pregnancy. We have animal studies that have showed no birth defects. And so, how it works is it's applied topically and it clears your pores out of bacteria that we know may be causing irritation or leading to those breakouts. And it also reduces inflammation. So, the acne actually becomes less visible. There's less of that redness and less irritation in your skin. And it gently encourages cell turnover so your skin heals more quickly and really minimizes the scarring because the scarring can be one of the most distressing parts of severe acne. Another treatment is salicylic acid, and this is also topical. It works by clearing out the pores by dissolving dead skin cells. And we recommend using this in pregnancy as a spot treatment to any specific acne lesions you have, and that's thought to be safe. And then lastly, another topical option is called benzoyl peroxide. And again, it is generally thought to be safe in pregnancy, especially when you're using it sparingly. And it's often combined with an antibiotic like clindamycin that we use topically. And this antibiotic can also be used in pregnancy as well. So really bottom line is there's safe treatments available. See your provider. And you guessed it, we did a podcast about this with Dr. Bree, all about skincare and pregnancy and postpartum. And that's episode number 47. So we'll be sure to link that in our show notes as well.
Yeah, awesome, Sarah. That's my husband knew I was pregnant before I did because I started getting a little bit of acne and I don't usually suffer from that. So it was quite funny. The other thing I got with the acne was breast tenderness, and this is so common. I
Oh my
I think
God.
this is
Yes.
generally the universal sign of pregnancy for
Yes.
most people.
Yeah. Especially your first pregnancy.
Right? Your breasts
Yeah.
just get so sore and they start to grow even in that first trimester. So again, guess who causes this? You got it, progesterone. So one of the best things that you can do for this is actually get a really supportive bra if you can tolerate it. Some people's breasts are just so sensitive that even the clothing on their breasts can bother them. A good supportive, even a sports bra can really be helpful. And you may have to tactfully warn close family members to be a bit more gentle, either with their hugs or their physical touch, until your breasts become less tender. And so this can be in intimate situations as well. You just may not want anybody near your breasts. And so just be honest about it. It does improve usually after that first trimester. It gets significantly better, but it can be quite significant and quite challenging for people to deal with. So again, something that you may notice is with exercise, it just may be more uncomfortable. And so again, really looking at a good supportive bra if you can tolerate that.
Yeah. For me, breast tenderness and nausea were my first two pregnancy symptoms. I know anytime I'm nauseous, I'm like, oh my God, am I pregnant? Don't worry, I'm not. I have an IUD baby. No, I have an IUD instead of a baby in my uterus. Anyways, TMI. Okay. Our fifth most common symptoms in early pregnancy is fatigue. That first trimester fatigue is real and it definitely tends to improve in the second trimester. But unfortunately, back in the third trimester, as our metabolic rate hits an all time high, it can flare again. So, why do we get so fatigued? It occurs for a number of reasons. But the first one, as I'm sure you can guess, is our friendly hormone, progesterone. So, progesterone can cause you to feel sleepy. In fact, people in the menopausal transition often thank the progesterone for a more restful sleep. The other thing that's happening is your blood volume is expanding, so you can get what we call dilutional anemia. So the fluid in your blood volume increases faster than your body can make red blood cells. So it's like if you're making lemonade, but you don't add enough concentrate and you're adding more water, the lemonade gets more dilute. The same thing happens with your blood. And so it seems like you have less hemoglobin to transfer oxygen around your body, which can lead to symptoms of fatigue. If you want to learn more about anemia and pregnancy, we invite you to listen to episode number 48 on our She Found Motherhood podcast, and we'll be sure to list that episode in the show notes as well. You know why you get fatigued, but what can you do about it? Number one is just listen to your body. Rest when you feel like you need to. Be kind to yourself. Have some self compassion. If you don't have the energy to do something, don't do it. You may not have the energy to do all the things that you usually do in the first trimester and throughout pregnancy, and that's okay. We also recommend connecting with your care provider and making sure that you get your iron and your thyroid levels checked in early pregnancy, as both of these things can contribute to fatigue and are easily and safely treated in pregnancy. And please be rest assured that most people get the pep back in their step in the second trimester. So if you're experiencing your first trimester fatigue, we sure hope you do as well.
Yeah, awesome. Thanks, Sarah, for reviewing all those things with me today. I think they're such common questions that we both get a lot in the office and on our Instagram page. So I think it's good to review it. And again, we have such more in-depth podcasts that we've done on most of those topics. So go check those out and in the show notes below. And if you find these podcasts are a way that you learn really well, make sure to check out our Pregnancy to Parenthood podcast series. It's over 40 podcasts week by week through the first, second, third trimester, around delivery, and into that newborn and postpartum stage. Really great information on there, and a lot of it we don't cover in our regular podcast. So make sure to check that out as well. And we really hope you guys have a great day.
Thanks for listening.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.